Hi, everyone. It's my privilege to welcome Dr. Friedley, a board-certified physician at the Rehabilitation Medicine Clinic at Harborview and a UW School of Medicine professor of both medicine and rehabilitation medicine. Notably, she's also the executive director at UW's post-COVID clinic. Today, she'll be talking more about post-COVID conditions.
Great. Thank you so much for having me here today. I am going to just take a moment to get my presentation loaded here. So let me know. Are you able to see that okay? Okay, great. Great. Well, thank you so much. And, just as way of background, I am a physiatrist, which is a physician who specializes in rehabilitation medicine. And work with people with chronic disabilities primarily. So prior to COVID, most of my clinical practice was working with people with amputations and limb loss. And then once COVID came about and we started to see that many of the people who were recovering from COVID, either that had been hospitalized and in the ICU for prolonged periods of time, and subsequently people who were recovering from mild to moderate COVID who didn't need to be hospitalized, but still were having persisting symptoms. I shifted my clinical practice to see those patients and help them rehabilitate. And started the UW post-COVID rehab and recovery clinic, and that we started the clinic in about May of 2020. So we've been seeing patients now for over 3 years, and so have seen thousands and thousands of patients in our clinic collectively with myself and many other physicians on our team. So a lot of what I'm going to share over the next 20 minutes or so is related to my experience as a clinician, seeing patients, and also really looking at the research that's out there and some of the research that our team has participated in as well. So I have no financial disclosures related to this talk. I'm an employee of the University of Washington. And I would first like to acknowledge the land on which the University of Washington sits, which is the land of the Coast Salish peoples. So just in way of background, many of you have learned quite a bit about long COVID already. But I do want to just start with a couple of words about the definition of long COVID and what this is. And there are many different terms that are used for long COVID. And in fact, there's a CDC definition that I'll share and a World Health Organization definition. And then the National Academies of Medicine has formed a committee recently to develop a working definition of long COVID. So hopefully over the next 6 months or so, we'll have more consistent terminology. I prefer myself the term persisting symptoms after COVID. Many of the terms that people use, things like long haulers or long COVID, tend to create an identity for a person and make it imply that this is something that becomes part of somebody's personality or their being, and it doesn't allow for a possibility of recovery. So I prefer the term persisting symptoms to describe what people are experiencing, because that allows for a description of what they're experiencing without defining them as a person and staying with them long term. But the most common terms that people will use, and I'll actually use throughout this talk, is long COVID or post-acute sequelae of COVID or PASC. So those are the two most common terms. So what is long COVID or PASC? So sort of combining the World Health Organization and CDC definitions, which are slightly different. It's really having persisting symptoms 3 months after an initial COVID infection that aren't explained by other medical conditions. And so these can be either new after you've recovered from acute COVID or persisting from the initial infection. And the symptoms can fluctuate or relapse over time. And I think it's really important to note that there is no diagnostic test for long COVID. So the lack of laboratory or imaging abnormalities doesn't invalidate the existence, severity, or importance of a patient's symptoms or conditions. So it's what we call a clinical definition or a clinical diagnosis. And we know that long COVID is extremely common. So this was a study that was done using data from the United States. And they modeled how many people, or estimated how many people are experiencing long COVID in the United States. Depending on how they did the modeling, either based off of people who reported having long COVID, or estimating a percentage of people who had an initial COVID infection and assuming that a certain percentage of them went on to have long COVID. The estimates were between 22 million to 43 million. So either way, just staggering numbers of people just in the United States alone. And the estimates worldwide I've seen are upwards of 65 million or more, which is likely an underestimate. And the reason that I think it's an underestimate of how prevalent this is that many people who are experiencing these persisting symptoms don't label themselves as having long COVID. So I think that's partly why this 22 million is so much lower than the 43 million, that there are many people, and we know that depending on people's cultural background or their own experience with other medical conditions, they may not label themselves as having long COVID or recognize that what they're experiencing is long COVID, and so may not be counted in some of these numbers. And then we also know that the research in general tends to exclude ethnic minorities and many different populations around the world. And so I think that there's a gross underestimate of the number of people affected. And the financial burden of long COVID is also staggering. So this report estimated that in the United States, the financial burden due to lost wages, lost savings, and medical expenses alone was over $500 billion. So really an incredibly difficult problem and one that's affecting just a massive number of people around the world, and people continue to struggle with this. So what do we know now about who's at higher risk for long COVID? Well, again, we're still learning with all of these things. If I give this talk in another year, I may have new information to bring back, or different information. But at this time, what we see, and this is consistent with what we see in our clinical practice, is that women tend to be more affected, ethnic minorities, particularly Black and Hispanic patients, people who smoke, people who are at a socioeconomic disadvantage, people with obesity and a variety of other medical conditions tend to be at higher risk for developing persisting symptoms after COVID. And we also know now that there are many strategies for preventing long COVID. So again, we are still learning, but the things that seem to lower the risk of it are vaccination. So still, vaccinations are incredibly important, and there has been some research that has shown that 2 doses are better than 1. So the more exposure to vaccinations that you have, the better. Any treatment that reduces the severity of acute COVID can help to prevent long COVID, so reducing the severity initially. And along with that, there has been research that's shown that Paxlovid that is used in the acute phase to prevent hospitalization and death after acute COVID, also helps to prevent long COVID. And there's been a couple of studies that have looked at the use of metformin, which is typically used for diabetes, which has shown that metformin can actually prevent long COVID to some extent as well. So more to come on that, but there are quite a number of strategies to help prevent long COVID. And there's also been a lot of work done, especially in the last year to 2 years, on what causes long COVID. And the Recover study that's funded through the NIH is a large observational study that's doing quite a bit of work on trying to understand what causes long COVID, what some of the phenotypes or different categories of symptoms people are experiencing and the trajectories, as well as doing some treatment trials. This study has shown again that it's a complicated process. This is a very complicated diagram. But really what we know is that the causes of long COVID seem to be related to a few different categories of things. There's some research that suggests that there may be viral persistence. I think the jury's still out on that, but there's more and more evidence that there may be viral persistence. And then the remaining causes seem to be related to your immune system response to that initial virus. So either autoimmune activation, microclot formation, or this cytokine storm that causes chronic inflammation and then chronic inflammation. So a lot of the strategies that we use to treat long COVID at this time relate to reducing chronic inflammation and really trying to support the immune system and regulate the nervous system to help support recovery. As the research has shown, and we certainly see in our clinic as well, there's over 200 different symptoms that have been reported with long COVID or past. And again, you know, I like this figure. This is something that we use frequently with our patients to really help patients understand how all of these different symptoms that seem like they're unrelated are actually related to one another. And so it helps to put it in perspective for patients that it isn't really a lung problem or a heart problem or a brain problem. It's more of a nervous system and immune system problem that's causing all of these symptoms, and they all are related. So again, in our approaches to treating long COVID, we have to look at all of these symptoms together and take a holistic approach. Because if we focus on just one of the symptoms, we're not going to make much headway because the patients are experiencing so many different symptoms. And the most common ones that we see are fatigue, brain fog, sleep disturbance, and anxiety. Although again, we see patients have many, many different symptoms. So can long COVID be treated? Well, I think the bottom line is that we still don't, even today, we don't have a universal treatment for the post-COVID symptoms. And you can imagine seeing the slides that I just showed you about the immune system and all of the different mechanisms for long COVID and all of the different symptoms that people are experiencing. It's very complicated, and the reality is that each person probably has a different combination of issues going on related to their immune system and the processes causing it, and the subsequent symptoms. And there's definitely different clusters of symptoms that we're seeing. Some people tend to have more of the respiratory symptoms, or some people tend to have more of the fatigue and the autonomic dysregulation or dysregulation of their heart rate and blood pressure type of symptoms. And so those treatments that people are going to respond to are likely going to be different. And so all of the treatments need to be tailored. And in general, holistic rehab approaches that combine breathing exercises, physical activity, self-management, and behavioral strategies are the ones that are showing to be the most promising of all of the treatments that are being studied. There are lots and lots of different studies that are going on. So again, we'll probably have more information each time that we give a talk each year. But the ones that have been the most promising so far are those that really are combining different rehabilitation approaches and looking at not just the physical symptoms, but also the cognitive and the psychosocial symptoms that people are experiencing all together. So the things that have been shown in clinical trials so far to be effective, as I just alluded to, are breathing exercises and helping to regulate people's breathing rate. And that can in turn help with the autonomic dysregulation of their blood pressure and heart rate, kind of slowing the heart rate down and lowering blood pressure and calming the nervous system down. Tailored multi-component exercise programs, so a variety of different ones have been studied and have been shown to be effective. Pulmonary rehab, which is another type of exercise program that combines sort of aerobic and strength exercise and breathing exercises. There have been studies that have shown that telerehabilitation self-management apps that are focused on getting people to be activated, so engaging in physical activity, health literacy, self-efficacy, and sort of self-management strategies have been effective. And then there's been some promising research that has shown that transcranial direct current stimulation, in different parts of the brain, the prefrontal cortex and the M1 cortex of the brain, it can be helpful for fatigue, anxiety, and some of those autonomic symptoms. So I think we'll see more research related to that specific treatment as well. And then there's just countless studies going on. I did a quick search of clinicaltrials.org, which is one of the clinical trials registries, and there are over 60 different clinical trials going on right now. There are some that we are involved with at UW. So there's a study that has been completed of an RNA immune modulator, so a medication that's aiming towards improving the immune system response. We're looking at different strategies for managing patients, whether it's through webinars like this one and educating primary care physicians on how to treat long COVID versus seeing patients in a clinic like ours, which is a multidisciplinary rehab type of clinic. And then we're studying whether group telemedicine sessions that are focused on self-management strategies that are led by our rehab psychologists are effective, and also studying whether acupuncture is effective. So there's a lot on the horizon in terms of the potential treatments that people may have access to and that may be effective. But at this time, the ones that have been shown to be effective really are those more rehab strategies that I just talked about. So at UW, the approach that we use is to use those kind of rehab strategies. We focus patients on a path to recovery and really try to get people off of the path towards disablement. And so we do that by achieving medical and emotional stability, helping patients manage their symptoms, helping them cope with some of the changes that they are experiencing in their physical and cognitive function. And we focus on lifestyle changes to help support recovery, as well as engaging patients in structured activity. And so it really is a holistic treatment approach. We have to treat mental health issues. So anxiety and depression are really common in long COVID. And long COVID causes depression and anxiety symptoms. And so it's really important that we treat that. We focus on people's sleep and getting people to sleep better. And then we do focus a lot on diet and making sure that people are adhering to an anti-inflammatory diet and a heart-healthy diet, as well as a tailored exercise program that will help them to recover. The most common symptom triggers for long COVID are pretty well established now, and this is again certainly what we're seeing in our clinical practice. And so we help patients to identify what those triggers are and then to avoid them so that they can feel better. So physical or cognitive exertion, stress, dehydration, weather changes, consuming large meals, premenstrual period. So there's definitely an association with menstrual cycles, and alcohol consumption are all common triggers of worsening symptoms. So teaching patients about how to avoid those things if they can, or to recognize the triggers and modify as much as possible to avoid them is helpful. We also spend quite a bit of time talking with people about how to manage fatigue. So not with medications necessarily, although there are some medications that we're using to help people with fatigue that are very promising. But the things that have been most helpful for patients that they report to us are these energy conservation strategies. So the 4 Ps, which are pacing, prioritizing, positioning, and planning. And this really helps patients take control over their lives and and get them back to doing some of the activities that are most important to them, even with the fatigue that they're experiencing. So I'm also an editor in chief of a journal, a medical journal called PM&R, and this is the official journal of the American Academy of PM&R. And the American Academy of PM&R has a national multidisciplinary PASC collaborative. So a group of now over 45 different clinics around the country that are treating patients with long COVID, who have come together to create these consensus guidance statements to help people with strategies to manage the common symptoms that people are experiencing. So we've now published about 9 of these and have several more in the works. They're great references for physicians and anyone who's interested in learning more about how to manage the common things that people are experiencing with PASC. So just in the last minute or so that I have, I know this is a very short talk, and this is a very complicated and big topic, but I'll just end with saying that there's a lot that I've learned from treating patients with long COVID over the last few years. And the most important things I've learned is that no two people have the same symptoms or the same course. So we can learn a lot from the literature and evidence about what the common symptoms are and the most common trajectory is, but each individual person is different. They bring to COVID many different things, all of their experience before COVID, whether they had underlying medical conditions or mental health conditions, how they lived their lives, all of the experiences after COVID all interact together to shape how people experience these persisting symptoms. So it takes a little bit of time for us as physicians to get to know patients and to understand where they're coming from and what they're experiencing to help them know how we can best help them. And although there's no single treatment yet for long COVID, there's lots of effective treatment strategies already. Patients are getting better with these. It sometimes takes 6 or 7 different things in combination and some trial and error and working with patients and coaching them over time. But there is quite a bit of hope for recovery. And we have many, many patients who have completely recovered and many who have gotten much, much better over time. And then the other thing that I think helps put this in perspective for patients as well is that I think of COVID like a lighter fluid. It lights everything on fire. So anything that people had before COVID, experienced before COVID, or that they were predisposed to, COVID just puts you over the edge. It just makes everything worse. And so there's a lot of other things that people are experiencing that may not be directly related to COVID, but COVID has just exacerbated it. So you have to think about all of those different things all together. And then finally, we hear this so frequently that patients are very relieved when they find doctors who understand long COVID, and so they really appreciate the care that they get from us. But access to these long COVID specialty clinics is really poor, and the support is really inadequate to manage that high volume. So when you think about more than 65 million people worldwide with this issue, we need to continue to educate as many different people as possible about long COVID and the importance of long COVID, and get more research in and more people on board to help care for patients who are experiencing long COVID. So I'll end there. I want to thank you so much for having me here. I'm happy to answer any questions either now if we have time, or through email at any time. So thank you very much.
Thank you so much, Dr. Friedli. This was an amazing talk, and I think that it's so good to know more about this emerging public health threat. And I think that it's something that's becoming more and more to the forefront. So, Dr. Friedli, could you please talk a little bit about successes you've seen and what has been the most striking for you in your journey in treating patients with long COVID?
Yeah, so like I said, I've had many patients get completely better after COVID, and people frequently ask me. I have list of sort of the most frequent questions that people ask me. And one of them is, how long does it take to recover? And as you see from my talk, it's very variable. And so it can take a long time, or it can take a shorter amount of time. But I've had many patients who were unable to work for even 2 years after COVID, but we've been able to get them back fully to work or to school. We've had many success stories. I myself had COVID early in the pandemic and had symptoms for about 9 months after COVID. And I consider myself a success story, and have gotten 100% better since then. And using a lot of the strategies that I help patients with. So, and it oftentimes boils down to focusing on getting good quality sleep, reducing stress, making sure that you're eating a healthy diet and getting the right amount and the right type of physical activity. All of the things that are really, good for all of us as well.
Yeah, thank you so much, Dr. Freely. That must be so gratifying to see patients in their journey as they improve and work towards recovery. Louise, if you have a question, go ahead.
Yeah, thank you, Dr. Janna Freely, for the really important, interesting presentation. So my question is whether there's a relationship between the number of times someone gets COVID and their chances of developing long COVID.
Yeah, it's a great question. So I think the single biggest risk factor for getting long COVID is having had COVID. So we know that. So and anything that you can do to prevent getting COVID in the first place will help to prevent long COVID. So the more times that you have COVID, it's possible that you could develop long COVID type symptoms. I certainly have had patients who report that they had COVID early on and they recovered, they've had COVID again, and then they developed persisting symptoms. I think it's less common that that's the case than people get long COVID symptoms after their first infection. And then every infection after that tends to just exacerbate things. And so many, and again, everybody's a little bit different, but I've had patients who have had 4 or 5 infections over the course of 2 or 3 years. And each time they do, they start to get better, they get COVID again, and they drop back down to their symptoms get worse, and then they recover a little bit and they get it again, and it's just one hit after another to their immune system. So everybody's a little bit different, but I do, the more we can prevent repeat infections, I think the less likely people are to get persisting symptoms. And then there's some people that just their immune systems are wired differently, and their response is different, and they've had multiple infections with COVID and they've recovered completely after a week or two and not developed long COVID symptoms. So again, everyone's a little bit different.
Yeah, thank you so much.
Thank you so much, Dr. Freely. This was a very inspiring and informative talk. And thank you so much for your time today.
You're very welcome. Thank you. Bye-bye.
Bye.